trying to bring really relevant and interesting content, and it's my pleasure to have a joint webinar today again with Toe Tactic. Oh, cute cat. Every time I learn so much from you, and I think you have a wonderful skill of managing your business and bringing new technology. So without further ado, the podium is yours.
Awesome. We appreciate that, and we are super excited to be here as well. I'm going to share screen. Okay. Can everybody see that? Hopefully.
Yes.
Awesome. Good deal. But yeah, we're super excited to be here as well. And if you're unfamiliar with toe tactics, our whole thing is we like to push the envelope and try and push podiatry to be all that it can be. If you've heard me speak before, I'm a little passionate and think that podiatry is unfortunately taking a little bit of a dip down. I'm not going to say that we're dying like I have in the past, but we're not on a good trajectory. And I think that it's important for people to speak up and partner with groups and services like TOEFX and others that can help bring in new ideas, new innovations to podiatry. So we're very happy to be here, very happy to be part of the solution and not the problem. Um, so like I mentioned a couple minutes ago, Dr. Frols and I are very informal. As you can tell, the cat walking in front of the screen. We You may see us take a drink of wine or a drink of beer or something along the way. If you guys have questions, you want to know specifics about something, please put a question in the chat. We want to make this super interactive and fun and engaging. So we'll jump right in. Ancillary made practical, real tips and tricks for a successful ancillary stream. Here we are. You're unfamiliar with us. It's Dr. Frills, it's Dr. Vanham, and it's myself. I think everybody knows us. I don't think we need to go into the detail of who we are, but there's some cool pictures of us. So I like to, Dr. Frills and I always like to follow this same kind of pathway for agenda. The Toe Tactics motto is diagnose, innovate, elevate. We try and embrace that mentality throughout everything we do. So I like to ensure that that is relevant within all of our agendas. So first off, we're going to go over how to effectively implement ancillary services within your practice. Dive right in. How do you actually implement them? Then we're going to talk about some practical strategies with real results. I'm a numbers guy. I'm a formulas guy. I will never just tell you, well, you could dream it, you can do it. I'm going to give you some formulas that you can plug into Excel, and does it truly make sense for you or not? That's the goal. And then we're going to wrap things up with some patient outcomes and building trust with your patients to drive clinical outcomes. That's the key. That is very, very important. We've got some unique insights taken away from the Disney Institute that we love to share with folks. So we are going to show you behind the curtain what that means. Dr. Frills, you were up first, ma'am.
So for me, protocols are essential to any practice. And when we talk about TOEFX, to me, it was challenging at the beginning to figure out how to layer this into our current protocol and how to discern between the two and what does our protocol look like at LexPod. So we've been testing this for several months, and we found it best to visit take a culture or complaint, initial complaint of a dystrophic nail, thickened nail. So we take a culture so we know exactly what we're dealing with. At that same visit, we have a brochure printed out. If your nail culture comes back as a traumatic nail or dystrophic nail versus a fungal nail, these are your gridded. So it's basically a template treatment options. And we go ahead. And so that's kind of like what we call a pre-sale, right? So we give them this information. We don't even know what the diagnosis formally is, but we're giving them options so they can go ahead and research ahead of time. So they're knowledgeable when they come and visit too, to go over the culture results. So they're already expecting laser or they're expecting TOEFX based on the comprehensive brochure that we provided them before. So again, culture comes in. What do? We have a fungal toenail. We have options. If they have poor circulation, what I do is I pair TOEFX with laser therapy. We use the Remy laser currently. but I want to promote circulation. So, with that being said, go ahead and add in a prescription for nitrobid, a pea-sized amount around the base of the toe between your culture, your nitrobid, and then also we recommend two over-the-counter options to go ahead and get started. The first one is from our line, Modern Podiatrist. It's called Relax. So it's Epsom salt infused with clotrimazole, as well as, we've got different products that have urea, lactic acid, things like that. Our pen called Repair has all of that in there. So they start out day one, before they even have the culture results, of knowing that they're going to have to soak their feet and relax and then apply Repair, because both of those options soften the nail and start to treat both items, dystrophy or fungus. So that's visit one. Visit two, they come in. These are the culture results. If you have fungus, straightforward, and you have great circulation, I go straight to the ToeFX. If you have poor circulation, I will go toe, and it is positive for onychomycosis. I will do the ToeFX and laser. If it comes back as a dystrophic nail, then I will only do the laser, just based on severity. And of course, option always is a nail avulsion at the beginning if it needs it. Either way, for fungus or a dystrophic nail. Or I guess what else do we do, Cody? Visit two, going over the supplement. So we recommend a prescription strength supplement that's going to boost nail growth. Again, irregardless of if it's dystrophy or fungus. I do not recommend that on the first visit because that's a big price tag to swallow. So we get them on the topicals that we know covers both. Then again, culture results come in. Poor circulation is ToeFX and laser. Continue the topicals. Then we add in the supplement. Fungus straight is ToeFX. So as far as protocol and, I guess the frequency is, and we'll go over that later on, I'm sure, with the frequency of ToeFX and whatnot, but laser therapy is one treatment a month for 6 months, 10 minutes. So you kind of get both benefits of using your laser and ToeFX. I think that's a huge pain point for a lot of practitioners. They don't understand when to use what. When do I pick this over that? So circulation was, to me, the most defining characteristic of that patient to determine which route to go.
Something I'll say on that is that's a lot. That's a lot from a outsider perspective of protocol built into ToeFX, and it includes like almost six items, six options all at one time. A key behind successful implementation is adequate training within your team. If you're structured like us, then it really doesn't come down to the provider effectively dispensing these products on the front end. It's up to them to kind of educate and say, this is the diagnosis that you have. Here's the treatment plan that I'm going to lay out. But the moment that you leave that room and your MA comes in to talk about donning, doffing, dispensing, wear, tear, all those great things, then they're going to have a plethora of questions. And if your MA is not able to step up and adequately speak to their questions, then you just lost that dispense. Your patient's not getting the care that you just laid out for them in the treatment plan, all because it's complicated. And it is for a reason. But the way that you effectively implement, you effectively implement those dispensing strategies is by onboarding only products that you trust, vet them, spend the time on it, make sure that you really know what you're doing, and you believe in what you're bringing on, and let your team test them. For ToeFX in particular, the number one question that we got upon day one was, how long does the blue uh, serum last? Does it really turn blue? Like, how blue is it? Is Kentucky blue or is it navy blue? What's the difference? So I tested it. That was part of it. Is we did a little study on me, and my nails were as blue as can be. Um, so we got to play around with it and see what took it off. Was it nail polish remover, or did I go to scrub them off in the shower? What would it take? Hot tip, chlorine pools. That's the best. That takes it off in no time. But really ensuring that uh, you know what you're talking about and are educated on the front end so that way you can answer those questions, so your team is ready to answer those questions.
So are you ready to start dispensing chlorine bottles in the practice? Is that what you're saying? Build that
I
into
mean,
protocol?
I'm just saying maybe Dr. Van Ham should think about putting chlorine in something. I don't know.
It's not a bad idea to have like because I think of people getting married and whatnot, like they have a special occasion and then they freak out, right? So it's maybe not a bad idea to have a vial of chlorine. I don't know. I'm completely going rogue here, but
So chlorine is not so great for the skin, but we have developed something we called it neutralizer.
mhm.
Um, it's the thing is that it worked, but not 100%. The reason is because the dye penetrates so deep into the fungal, so it's washed away the blue from the nail plate, but not deep from the fungus. So there was, it was kind of hard to educate. We are still working on this, but maybe someday. But and also it's good for the serum to stay in the nail plate for a little bit. So yes, but it's on the works. Maybe so. It's yeah.
Love it.
We have here a Dr. Cass wanted to ask a question. Is it okay that I will allow her to allow Jeffrey
You want
to
to read your
speak?
question maybe?
Was it? Oh, was it in the
For
Q&A?
him?
Yeah. Oh, that he says he doesn't know what TOFX is.
Oh,
Carter.
okay. We'll tell you soon.
Yeah, it's
Do-
Well,
good to.
before I'm sorry, go
Dr.
ahead.
Fields, I have a question for you. When you use laser in combination with TOFX when there is a blood circulation issue, are you using the laser only on the nail plate or also on the toes? Like, how are you using it exactly?
I use it on the cuticle.
The
I want to
cuticle.
promote circulation to the cuticle area, which is the matrix or the root of the nail. I
Mm-hmm.
don't care about the distal part because I know I can't help that. If I can get the root clear, then I'm confident as soon as like after 3 months, because nail growth is a millimeter a month. About
Mm-hmm.
after 3 months, you should see that clearing under the cuticle. And I always tell patients, I'm like, I don't care what the nail looks like distally.
Right.
If they've got a proximal clearing, I'm like, we are good. Let's keep going. So that gives them confidence. It gives me confidence, to be quite honest. But you're looking at a 3 month minimum wait time, unless you add a supplement and then adding the laser therapy will promote that circulation to get it to grow faster.
All right. Well, marketing. So I think marketing the next step in actually ensuring that you're being successful in this dispensing is I think of it as a three-prong approach of three opportunities to convert on new ancillary opportunities. The number one is your patients that are coming through the door. They're already planning to come through. How can you increase that opportunity for conversion or that rate of conversion? The number two is the recalls and resubmissions, patients that are off of your panel, but you still have some kind of a newsletter, you still have a touch point on Facebook, Instagram, whatever, re-educating them on, hey, guess what? We got this fancy new machine, this fancy new product, whatever. And that little nice engagement brings them back in. And then last but not least are those organic patients. That's the bread and butter. That's the ones that everybody wants to learn how to actually obtain. If they're not predicted to come through or they haven't already touched my door, how do I get them? That's the most difficult. Obviously, that's where you get into your Google ads and your boots on the ground, shoe leather marketing, collaborations with outside folks, with outside groups. That's the tough one, but
My
three-pronged approach.
first my first target demographic in terms of a referring provider to showcase this nuance procedure would be dermatology. And honestly, then secondary would be family practice. I would completely blanket on my dermatologists and even do offer. You could even come to a demo. Maybe someone on their staff has a fungal infection and you could do a demo and then come on site. I think that would be really impactful for them to see the process. And plus, the person there is getting a free treatment. It's going to create a lot of buzz and engagement. and you can do like a fun, I don't know, a cake or some type of just something to play on the fact that you're treating fungus that's funny, that they get a little treat or something. It doesn't even have to be food. Like it just could be samples of whatever antifungal medication or supplements or something like that. You know what I mean? Like get to sweeten the pot a bit.
Exactly.
What's the
Right.
value? When I market, I always think, what is the value to that person? And I work backwards because no one cares about me. They don't care that I've got all these degrees and whatever. How can you help me? And so
Mhm.
my marketing message is I can help. So I start with I can help you this way. And then if I need to layer in credentials or something that's beneficial to that conversation, then I will, just add some street cred or something like that. And then I'll end it with, again, the value to that person, that provider, or whoever it is. Because again, they don't care about us. So think about any type of marketing initiative to like, what are they getting? What's the value they get?
So what's the value that derms are getting?
Well, the dermatologists now have an alternative other than Lamisil. So they now have two options. If you're educating them on not only TOFX, but you also have laser, and you talk to them the difference between, hey, I know you have patients that are either not a candidate for Lamisil, or maybe they've tried Lamisil and it's just not effective. So why? And a lot of times it's either from poor circulation, untreated hyperhidrosis. Of course, poor hygiene's in there, but let's take that out. Like, what is underlying and systemic that we can address, at least give them that knowledge. Because I tell patients with poor circulation, I'm like, listen, we can try whatever you want. I won't try Lamisil on patients with poor circulation because I'm just not confident it's going to go down to the toes with it doesn't have enough oxygen perfusion. Um, but I have no qualms in recommending something non-invasive that's completely superficial for cosmetic reasons. And as long as they know and you're transparent, I document, patient understands they have poor circulation, their outcome is unpredictable. They, will be compliant in applying nitrobid once to twice a day, doing this, and this. And so when they come back in a year later and they're like, it didn't work. I'm like, remember we talked about circulation and this is what I said. Did you do that? And they're like, oh, I didn't. I'm like, kind of on you. It's not on me. I can't give you better blood flow. It's an age thing. So anyway, I just am very honest and like I said, transparent with them. So expectations are very clear and well defined prior to accepting any cash for this service or any other.
Yeah, I think we're going to give a webinar on or something on setting patient expectations soon.
Yeah, we've got that in toe tactics.
That's
Yeah,
a hot
for
topic right now.
sure.
But taking the marketing efforts one step further, we already talked briefly on these three items. But internal marketing again, the newsletter. I don't People vary between how often they send out a newsletter. Ours is like 10,000 people, I think, somewhere around there, a good healthy number. But we found that if you do biweekly, then your spam rate increases pretty exponentially. So I personally like about a month newsletter that goes out, and it's very educational. It's very engaging with the team. Um, it's something that brings, again, like Dr. Phil said, value to the patient because all marketing is moving to this story brand type of methodology of they don't care about you. All these patients are doing is just typing in podiatrist near me. Then and there's a million of you guys. What they care about is who is valuing what they need. We live in a society of they want it here, they want it now. They want to feel heard. They want the empathy, and that's something that's lacking heavily in medicine right now. So being able to promote empathy on the front end of your website and say, you've got this condition, here's how I'm going to help you. That's it. That's all they care about. Implement that type of mindset in both your internal and your external marketing, even on your social medias. Yes, they do want to see some of the interaction with the team. They want to see Devin, who's a star in our office, talking about a product that he stands behind that he really likes. But at the end of the day, he starts that message with, "Do you have this condition? Are you suffering from this? Here's what can help you," and walking through that with them. And then last but not least, that shoe leather marketing. It's back, baby. It's back, and it's going to be not bigger than ever. But the 2020 kill of vendors and referring doctors going and knocking on doors is over. Docs value you coming and educating, re-educating them on who you are, what you do, and how you can bring value to their patients. Um, that's one shoe leather marketing. The other side is partnering with your local vendor or with your local resources. Dr. Gretchen Lawrence is a huge advocate. She works with the YMCA weekly, and I think she's going to be doing something similar to what we promote of get with TOEFX, get with Remy, get with some kind of a service out and have a session where you're educating and giving some kind of a free session with people there. And it's going to be a nice avenue into your clinic for those ancillary services. Um, again, empathy in healthcare is dead. Everyone is doing this nowadays. There's no value in you having a Google ad at the top, being a sponsored person at the top of the page. I have not clicked on a sponsored ad probably my entire life because it's out of spite, if I'm being honest. I feel like if you didn't earn that top SEO spot, then I don't want to go to you. So maybe that's just me, but everybody I've talked to so far agrees that they don't remember the last time that they actually clicked on a sponsored ad. It's not worth your marketing dollars. You should spend your time elsewhere, knocking on doors, creating relationships.
So Cody, how do you use social media? Do you do you post weekly, like short videos? Sorry, I didn't see your post, so it's
Yeah,
my team doing that. But
yeah, we're fairly big on socials. Our biggest one is YouTube. We've got a large following there, but on Facebook, Instagram are two biggest that we actually garner patients from. And our content is really mostly around our staff. That's what people like the most, like a happy birthday, Angelica, or and I like to pick on Angelica. She just graduated with her RN from our office, so it's like a congratulations, Angelica, you're moving on and doing bigger, better things. Um, because it's patients that you have already touched. It's patients that you're not going to recapture. You're not going to capture a new person unless it's a walking billboard of yours that is sharing that, or it's in the back of the brain of like, hey, Lexington Podiatry has an RN on their staff that they just promoted up and grew. Or we've had three docs that have come through our office within the last year and a half now, and every time that we send that out of congratulations, so and so is moving on to med school, then we get a ton of comments of, "Hey, I remember that person." So there's like five doctors in your office, actually. That's cool. Um, Something that promotes that engagement and gets their gears turning, because then they're going to talk about you. All that you want to be is memorable and talkative. Because when grandma has an ingrown or she steps on a stone wrong and twists her ankle or whatever, then you want to be the top of their mind and say, "Ooh, that clinic. I remember them. You need to go there." So what we do right now is twice a week, I believe, twice a week on socials, and the content varies. Our marketing coordinator sends us a list of everything that she wants recorded. Dr. Furls and I make a strategy each month of what's the main topic, what's the diagnosis that we want to focus on, and then the marketing coordinator just says, okay, you need this type of video that's talking about XYZ, and this type of video is talking about XYZ. And she gives the providers homework. We record in office. She makes them pretty, post them. Simple. Strategy is important, people. If you're talking marketing, do not throw spaghetti against the wall. Do not waste your marketing dollars, please. I'm a huge advocate for that. Both Dr. Vanham and Dr. Frills know that I hate marketers. So
I think the biggest takeaway from this slide would be, or not this slide, but just in general for social media, is like he said, to have a comprehensive strategy. So, say you're rolling out TOEFX. All right. You want to not only talk about TOEFX, but you want to talk about Lamisil. You want to talk about everything out there that they know about and why this is best for this patient candidate. So educate them on what they can do. And I hate to use this word, but like the scare tactic of if someone has, and they just need education, right? And that's what all the commercials do. They're educating people on to buy their drugs. So we need to educate them on number one, what's all available, not just this siloed Lamisil and that's it. We need to say, hey, this is what's happening if you are sorry, my new cats are getting angry. Um, but they need to not only understand what is available to them, but what is best for them in particular. And highlight, like, this is more like, make it more personal, I guess, is what I'm trying to say. Like, if you're, on cholesterol medicine, you can't take Lamisil, period. And this is what
Yes.
you have to do. Okay, sorry. In
She got two new cats yesterday. So, all right, we're on to the math. We're on to the nerd stuff. So buckle up, people. The biggest thing for me before I agree to bring on any new ancillary service, any new product, any kind of investment, because even if it is just a product, you're talking new RX, Theranel, EVM, that's an investment. It's something that's going to sit on your shelf that you may not be able to move. That's going to burn a hole in your pocket and frustrate you every time you walk by your stock and see it just sitting there gaining inches and inches of dust. So do your homework on the front end and ensure that you are successful, that you can be successful in the effective dispensing at a rate that makes sense. So this is a formula that I like to use for pretty much everything, if I'm being honest. But I'll talk through it a little bit. If there's questions, please tell me to slow down. But thinking of a condition, thinking of an ancillary service that treats fungus. I mean, this same thing could be applied to a Remy laser I know there's a question about does it actually treat fungus? And I'm going to let Dr. Vanham tackle that after this slide. But say that it does, or say we're talking specifically about TOFX. 20 to 40% of patients that walk through your door are anticipated to have fungus. It's probably more than that. Most practices that I work with, and I've tested this theory, are higher. So we'll shoot low just because of numbers sake. It's there on the slide, so why not? So let's say 30 to 30% of the patients that walk through your door have toenail fungus. An ideal conversion rate for a non-medically necessary service or treatment or ancillary, whatever, is 30 to 50%. Let's say 40%. Why not? Let's shoot in the middle. Let's say we're okay with what we do. So to come up with your anticipated revenue for any service, take your anticipated patients, multiply that by your cost per session, multiply by however many times you're doing it within a month, and you get your revenue. So do some math. Say you see 400 patients in a month. That may be a little high for some folks, but it was the first number that came to mind. So why not? So 400 patients times 33% is 132 patients. So 132 patients that walk through your office have fungus and are a candidate for a treatment service like TOFX. Multiply that by 40%, because again, you're only anticipated to convert on about 40% of them, especially if you are marketing your costing is at a level that makes sense to you. Because I am also not an advocate for just double your price. Don't just say my vendor charges me $10. I'm going to charge $20. It took you time to come up with that product. It took you time to talk about it. Value yourself at least a 75% markup, 75 to 60, no less than 60. You do that, I'm going to yell at you. So that brings you to 53 patients. 53 patients within a month are eligible for or are expected to get TOFX. Our office charges $150 per treatment session for each of those patients. And there are 2 treatment sessions per month because it's 10 treatment sessions. So it's a 20 week period. And Dr. Van Ham, please correct me if I'm wrong, but 20-week session for 10 periods, 10 sessions. So that brings you to, I did the math beforehand. Why didn't I save this? That's silly of me. So 53 times 150 times 2. It's $15,900 per month that you anticipate to bring in just this one treatment, just in this one ancillary service. that may not make sense to you. And I'm picking on TOFX right now because that's who we're talking about. But if we're talking the same modalities, the same formula applied to a soft wave machine, which I love soft wave, at $85,000, that's probably going to take you some time to pay that sucker off. That's a bit of a heavy investment. But if your product only cost you $5,000, then you just paid it off times three, just like that. That's an easy investment. That's an easy decision. Um, Now, again, it takes time to get to that right conversion rate. It takes practice. You have to be good at what you do. That's why we're here. That's why we want to answer questions and kind of teach you how to go about that. And we've talked a little bit about it beforehand. We'll dive more into it a little bit later. Dr. Vanham, I'm passing it over to you, ma'am, for the
Sure.
time being.
You can see my slides, right? All good.
Yes.
Okay, so yeah, if you wanted to know what's TOEFX, so we are complete business unit end-to-end care for onychomycosis. We created cutting edge diagnostics, so it's available also in the States. I can talk about it, but it's not the purpose of today's webinar. And also we created a light therapy for the treatment of onychomycosis. So what's unique about our device? What's unique is that we tackle the infection from all perspective, physical, biological, and chemical. So the physically we encourage to do debridement, and when you combine it with the light and the serum, it's really you create a magic. So the light, it's called photodynamic therapy. It comprises of this light. It's a dual wavelength, a very strong light, red and blue, and it's combined with a blue formula. What you need to do, you just file down the nails, apply the serum. It adheres predominantly to the infection and stain it, and then the patient sit under the light. Super easy. We got accepted. We did a very large clinical study, one of its kind. We looked at 92% severe cases as opposed to other clinical studies where they normally look at mild to moderate cases. We looked at severe cases. We looked at 165 toenails, and the efficacy was found to be 73%. And what's cool about it, because the affinity of the blue serum is very selective to the infection, so it's 100% selective. It doesn't do anything to normal cells, as opposed to lasers, where if you want to use laser for the treatment of onychomycosis, you also damage the normal cells. Also, what's nice about it, because the patient mainly sit under the light, you can treat, and we encourage to treat all 5 toenails at once. And also, you don't need to, for example, go over the nail plate yourself. This is how it works. So I compare it to laser because it's another light therapy. So those are a few before and after 6 months. So you have a confirmed case of onychomycosis after proper diagnostics, of course. You have readily available oxygen everywhere, also in the nail bed where this fungus resides. So you file down the nails, apply the serum, let it penetrate for a few minutes, and then you shine the light. So what's happening, it's pretty cool. The blue dye is in the membrane of the fungus and just does nothing. When you shine the light, the blue is like a mediator. It's mediate between the light and the oxygen, and it's transferred the access of the light into oxygen and makes it reactive. So it's ROS, and it's destroying the fungus, and doesn't do anything to normal cells because there is low affinity. So it's pretty cool. What's also nice, that the blue formula adheres predominantly to the infection. So you can see this is a confirmed case of onychomycosis. This is 2 weeks later. So you can see that the infected area is still blue. So it's a marker for you to know where to treat more and where to focus. But also, as Dr. Frill said very nicely, it's really nice for the patient to see the new growth of the proximal edge, because if it would have been total dystrophic in onychomycotic nail, so they think sometimes patients that the nail plate will recover, but not. But the blue actually helps them to see the progress from the proximal edge, which is very cool. I also wanted to show that we have the blue wavelengths, and which is shorter. The shorter wavelengths doesn't penetrate so well, and we have the red. So the blue is 410, the red is 660 nanometers. The blue kills the fungus on the surface of the nail plate, superficial fungus, but the red, together with the serum, penetrates where the fungus resides in the nail bed. The protocol is super easy. You prepare the toe, apply the serum, wait for a couple of minutes, and then the patient sit under the light. This is a typical course of 10 treatments. We recommend 10 treatments bi-weekly, every 2 weeks. So T2 is after one session only. You can see the debridement. You can see also how nicely the serum adheres to the infection, so all the blue areas are infected. You can see at T6 some progress. Normally after 6 treatments you see a progress. Before that, especially if you have a problem with blood circulation and it's chronic infection for a few years, so it takes time for the nail to grow. So this here you can see that the distal and the lateral medial edge are infected because they are still blue, and at T10 you can see how nicely new nail came in. The blue at the distal edge is not fungus, it's just that the formula likes to stay there for a bit longer. And here, but I don't think I should repeat that after Cody's really nice explanation. But we create TOFX in such a way that the break even will be pretty fast, and also the ROI will be very healthy. And I can speak about it more. If you want to meet for Zoom, by all means, I can explain how we got those numbers, and also here. Here is my contact information. Also, we'll send you an email, but even after this session, please feel free to text anytime. If you have any questions about the mode of action, the science, and everything related to that, please don't hesitate to ask. So now I stop sharing, and back to you, Cody.
I think you do have one question in there that is best suited for you. Is it not true that studies have shown that laser treatment does not help fungal nails? You're going to be able to speak to that better than I can.
What's the question?
Is it not true that studies have shown that laser treatment does not help fungal nails?
Depends. So there are a few clinical studies that lasers do help, but they do not help severe cases.
And then
My personal opinion on that is much like Lamisil when it came out on the market, that prescribers were giving it to just about everybody, and they did not understand candidate selection. So I think this is a cosmetic procedure. And again, the first thing is setting the expectation. What are you dealing with? You cannot, this is not a black and white transaction. To me, it's more like you have to look systemically what else is going on with the patient to determine if they are the right candidate. And if you feel that they are not, but they still want hope and help, I don't think any of this hurts. I mean, I know it doesn't, right? It's all cosmetic outside of Lamisil. So I tell them, I'm like, I feel confident that I can improve the look. How much I can't guarantee. And they're usually fine with that. They're like, I don't care anything better than what I have right now. It's like having that one spot on your body that you just can't lose weight at or whatever it is. And you're like, I don't care if it's a millimeter. It makes me feel better. And that's how this is for these people. I mean, if you've ever had toenail fungus, it's very traumatizing, especially to people that are more cosmetically geared and aesthetically, concerned with their uh, looks and whatnot. But again, setting the expectation to me and selecting the right candidate and being honest with them mitigates a lot of any negative pushback from cost versus outcome because you've documented we had this discussion and then they have agreed to that and they're like, yeah, it's in the note, so sorry. And I take a lot of time because I don't want that on my reputation personally. So if anybody comes back, and it honestly is never an issue because I spend extra time on the front end selecting the candidate and educating them on the outcome or potential negative outcome.
We get another good question in here from Dr. Cass that's over my dumb head. But with the amount of nail debridement you are showing in your typical case, I would be afraid you would incite disappearing toenail syndrome. Any comments? It's a new one for me.
Um, I'm not I'm not sure that I know how to answer that, but what I do know, that nail debridement alone does not help with onychomycosis. So we really encourage to get rid of the fungus load and the keratin load before applying TOFX. So
Can
I,
Dr. Cass jump on a live and we can talk about that a little more in detail because I feel like we just need a little more clarity with that question if
I
they're
don't think
interested,
that
or
I,
we can talk separately.
yeah, maybe
You
we
know,
save it to the end. Do that. Yeah,
okay.
cool. And before we go into the rest of our slides, I have not seen it yet. Um, I haven't seen that as an issue yet, and we've been using it for 6 months. I ran our numbers this morning. I forget the volume wise, but it's over 55,000 in TOEFX revenue. So whatever that adds up to be, and we haven't had that issue yet. Knock on all the wood possible. All right, moving on. Now tying it all together. So we've kind of mentioned this before, but the the key behind effective ancillary dispensing is trust. It's trust between you and your staff, it's trust between you and your patients, and it's trust between you and the product or the service that you are promoting. If you can't stand behind it, your staff can't stand behind it, then you're not going to be successful in anything that you do. It's going to be a waste, honestly, to speak candidly. So Dr. Furls ended up going to the Disney Institute. Gosh, this is a while ago. This is like 10 years
Before
ago or
COVID.
so, right? Yeah, okay. Yeah. And took away a lot of key points that we have embraced into our modalities, into just our treatment plans and how we do business. So that's kind of what we wanted to show a little bit of what we have implemented within Lexington Podiatry and everybody that we work with to try and build up that rapport and that trust in those three different areas that I spoke about. So, number one is the intentionality, ensuring that you are being goal oriented in everything. That's what she's referring to whenever she is open and honest with the patient. So she sits down and she says, here's the expectations, here's the cost, here's what it's going to look like if you don't invest into your care. If you don't invest and you just want to do an oral, you just want to do a topical, expect subpar uh, results. If you really care about this and you're a vain person like me, then invest into it. Spend the money, spend the time to make sure that you are getting the best care that you can possibly get. If not, okay, that's all you. But be intentional and be direct with your communication because they deserve that. Next, be memorable. We talked a little bit about that again in our marketing efforts, but even when a patient walks through the door, you want them to have a uh, an experience. You want them to walk in and remember it. We're often quoted or recognized as having a spa-like atmosphere at Lexington Podiatry. We wanted to really shake up and not have that stereotypical podiatry feel. If you smell a foot when you walk into our office, somebody's probably going to get fired. That's not good. We want to create a positive experience that breaks the stigma, that breaks that that expectation because it just sets us and the patient up for success as soon as they walk through that door. Um, Dr. Frills, I'm going to pass over the special touch and high quality to you.
Yeah, so the special touches, Disney has a way to get us on the hook to spend money and not just any money, spend a lot of money and actually want us to do it. So, how do they do that? They do it in literally every facet that you can think of, from in their terms like the cast experience or the customer experience. Well, that's our patient experience. So there's a picture of me in a cookie. The reason this is taken is because I was at Disney and I was looking at these sugar cookies, and I mean, I love, sweets and all that stuff, but I'm not going to buy it because who's going to buy a cookie? It's bad for you, whatever. It's late at night. So I go and I'm looking at the counter and I'm like, damn, that looks really good. And they must have picked up on that. So that them paying attention to what I was non-verbally doing, he came over. He's like, "You want a sugar cookie?" And I was like, "He's like, it's on me." And I was like, "Well, yeah, I want a sugar cookie now." And so to me, that's like, so that's a special touch. It's memorable. The quality is there, but it made it so much like I took that away and I've told 30 people. But then I went behind the scenes to the Institute, and that's something they do because they're going to throw the cookies away anyway. So it's a way to, in our world, we make it right, give them these little things, but we can do that in a very inexpensive way that is um, creating a massive impact and a massive touch point that they're going to tell 20 different people. So to me, it's those teeny little things, again, the special touch, and then having that extraordinary quality. If it's, you can't give them a crappy ass brace and expect them to go around town and tout your services whenever you've given them something that costs $5. How do you differentiate yourself from your competition? We use more like premium DME. It costs us more, but we are getting better feedback, from our patients, and they continue to perpetuate our reputation. They're walking billboards for us. So that's what Disney has done in just like a freaking very small amount of information from Disney, because it's a fantastic, they've got it down. They know exactly the human experience and how to touch people in certain ways. It's very strategic. And that's where Cody said it's very intentional.
Yeah, that's where I like that. I like the sugar cookie story so much because it's such a small investment, and I've heard her tell that story at least 100 times.
Because I value a sugar cookie
And that
that
is
I
a
wasn't going to
walking
buy. I mean, it was
billboard.
massive for me,
Yep.
but what is it for everybody else? That took that person not watching me, but recognizing I'm going to dump these cookies anyway. I know I have this option that I can give this customer a free cookie, and then everything, the protocol was in place, and I fell very much into the trap of the Disney. That's why I want to spend so much money,
Mhm.
because of a cookie that probably cost him 3 cents.
Yep. And they got a walking billboard for the rest of her life.
Off a
That's the
sugar
key.
cookie. That sounds really
Oh,
good right now too, though, especially with my wine.
ooh, the weird pairing.
No, cookies and wine. You're weird.
Sugar cookie, probably. All right. So the Disney it preaches on these four pillars. It's key to everything that they do. They have they play off of the five senses. They have certain pathways and certain efforts that they put into promote like a scent pumped out of a float as working on your factory system, or the every time you walk into a new like land within a park, they change the cobblestone to brick to match the vibe and the feel. Um, the trash cans look different. Everything is intentional and purposeful and built around your senses. But then aside from that, they have the pillars that they work off of. And the number one thing that they want to focus on is safety. I don't think I've been to Disney a handful of times, and not a single time have I felt unsafe in any way, shape, or form. They really spend a lot of time and energy on ensuring that it feels secure, it feels happy, and it doesn't put you in any kind of uncomfortable type of frame of mind. That I think that's really where they want to get at, is reduce, eliminate the uncomfortability of a situation. And then the next is the courtesy. You walk through the gates of Disney, and you've got 10 people that are smiling at you and welcoming you. We want to do the same thing within our practice of you walk in through our doors, and we literally have a kiosk that's right in the front of somebody checking you in that's welcoming you into the practice. That's the first thing that you see, is that smiling face. That's, I'm here to help you. What can I do for you? It's an investment, but it immediately puts that guard down. They're walking into a doctor's office. They're expecting to pay a bunch of money. They're expecting to be poked and prodded and stabbed and have a needle shoved all the way through their foot. They're not looking forward to it, but they just seen somebody that is bright and shining and smiling at them, making them feel great as soon as they walk through the door. That is paramount. Appearance is huge. We do our own cleaning within our practice, and we want to ensure that I've worked with probably 20 or 30 commercial cleaning companies, and they all start great for like a month, and then it goes downhill so fast. And next thing you know, I'm looking for another one. I can't have that type of expectation, or I can't have that type of turnover and just nasty office. A patient walks through the door, they don't want to see toenail dust, shavings rolling around on the floor like tumbleweeds. They want it to be pristine. It's a medical office, and it should feel as such. And that goes even into being on brand of I won't talk too much about that. That's you. Um,
Well, I want to like
Jenna. Yeah.
elaborate on that. No, I just want to talk about the stereotype. The stereotype
Mhm.
of a podiatrist is a very elderly gentleman, and the office is disgusting, out of an old house, toenail dust everywhere. So and I am a huge fan, if you follow any of the things that we do, like publicly or whatnot, huge fan of being the salmon and going upstream. Whatever everyone else is doing, we don't do, pretty much, because how else can you be memorable? So, in terms of the stereotype of podiatry and whatever your personality is, it doesn't have to be what my personality is, but it's genuine and authentic. And so, when patients come in, they see that this is something that it's our vibe. It's like we were playing 90s music today, like whatever we feel like, whatever our jam is for the day, but our patients appreciate it and we embrace every holiday. So anyway, my point is break the stereotype of a podiatrist. If you feel that you are in that arena of like, I like being a traditional podiatrist, fantastic, do it, but do it well. Like to me, I think of a traditional podiatrist as my grandfather, very much old school apothecary style, hardwood floors. You lean into that. Sorry, I'm getting off on branding because I love marketing stuff. But
I
anyway,
knew she
break the
would.
stereotype. I know, right? Sorry. Fast forward. All right, Cody, back to you.
Yeah, efficiency being the last one. And I'm sitting here recognizing that you're wearing a Mod Med shirt. Um, one way that we maximize efficiency and ensure that we are on time at each of the components within our practice is through ModMed's office flow capability. If anybody's on ModMed, they know what I'm talking about. But our system, our process, into the weeds because I love operations. She loves branding, and I love efficiencies. So it's 15-minute segments. Every appointment is about 45 minutes long. 15 minutes with the roomer, 15 minutes with the doc, 15 minutes with the DME. We know the moment that the patient walks through that door, how long that they're sitting in the waiting room to go to the roomer. and there's time thresholds set on that. It starts to turn red. My team leads coming to the front and grabbing that patient and bringing it back. We don't want anybody to be in the red and past a certain threshold that I've set as being too much. Same with the rooming process. If it's taken more than 15 minutes to room that patient, then the process is turning red. Somebody's jumping in and moving them onto the next stage. That's how we stay efficient and keep every patient in line with a certain threshold and very um, operationally sound, I guess, best way to put it. Like an assembly line. And patients want that. They want to feel like they are part of a system that is working. They don't want to feel like I'm sitting here for 45 minutes because the patient in front of me was talking too long. They don't want to hear that. They don't care. They want help now. They had an appointment scheduled. Why is it taking them longer to be seen than the annoying person that was in front of them? Or the doc was late, the doc was sick, whatever. Don't care. See me when I was scheduled. Keep them on time, keep them efficient, keep the expectations set. Efficiency is expectations. It's as simple as that. Set expectations, you will be efficient. That's all we got. Looky there.
Right on time. That never happens with us, Cody.
Wow, that was
Yes,
crazy.
on the minute.
Yeah. Well, what do we want to go into questions at all? Or are there anything? Stop sharing my screen. How do I
If
stop?
anyone has any more questions or wants me to share our protocol written out, just let me know. And I'm happy to do that. Just email myself or Cody, or, we may share it in our toe tactics group. This is, we're doing a big webinar tomorrow, toenail fungus deep dive in not only toe FX, but a comprehensive everything that we do just based on onychomycosis or unsightly nails, whatever you want to call it. So just a heads up, but we've had nothing but success from this product. And personally, I'm just happy to be able to offer something different. Because I mean, I love the laser, but there are also limitations with that. And I think providing them together is beneficial, but then also providing each separately is also beneficial. So we kind of break that down.
Absolutely.
No questions? Wow.
Yeah, we have a question, I think. Just a second.
That is in a hand or is it Rose?
Someone someone raised their hand, right? Didn't see.
Yeah, I thought I seen one. So we've done for ToeFX, we've done 181 sessions in 1, 2, 3, 4, in 5 months.
And that
I think
equates
that's
to 55,000.
yep. I think that's pretty
And our
good.
machine costs, or what does the machine cost? Sorry.
Hey,
It's a bit
I'm sorry.
how
sorry,
much is it
just
now, Dr. Van Ham? I think she's trying to get somebody in.
yeah. No, no, I was replying to someone. Um,
Oh, cool. Oh, is Dr. Cass still here? We want to chime in with him?
Yeah, that'd be great. Um,
Yeah, he's
we
still on.
may want, are you, or do we have a toe FX and toe tactics promo or anything that we can share maybe
yeah.
tomorrow?
Yeah, so if um someone will decide to get Toe effects in the next few weeks, we are happy to sponsor the first ones with the
Oh
Toe
yeah.
Tactic Mastermind Group.
So what that's about is there's a so we have Cody and I have our private hub of toe tactics podiatry innovators hub, but then we also have a different level where you really get direct access to everything we do in our practice, private phone calls or whatnot, and that's what you're talking about, that they get an automatic free subscription to that for a limited amount of time, but then so that's a nice additive, I
Mhm.
would say.
Yeah, especially
Free
when you're
consultative.
onboarding a new product.
Oh
That's,
yeah,
I mean,
cut out the guesswork.
yeah,
Exactly.
especially one of
But we
Especially
these.
already
that,
did that. We know it doesn't work. If you want to know that, let us know.
no,
Yeah.
especially that we learned throughout the years That sure. So you discover a new technology, but it's just the beginning, right? Then it's the onboarding to the clinic, and then to train the staff
Staff,
and how
yes,
to price it.
Yep.
there's
Yeah.
certain buzzwords you want to avoid. There's ways you want to present it in a certain fashion. Like you can't say, uh, for example, when we brought on the laser before ToeFX, we were testing out in what sequence do we bring up the surface of topicals, Lamisil, laser, whatever, avulsion, whatnot. And so we tested out. And so we know the exact sequence of verbiage that should be presented that will be maximally beneficial or resonate with the patient to improve your conversions. And so that's what we're going to be sharing.
Oh,
Mhm.
you tested it in terms of how to present it to the patient. Yeah, cool.
Yeah, we test everything like that. I need to know where I lose that patient and what process of the patient journey. It's like, oop, I've lost them. So that I go back to the drawing board and I'm going to reformulate my pitch, if you will, because it's truly what you're saying is the same information, but how we hear it and how it's presented to us is different. So we've tested in our practice over with all of our products, all of our services, like how do we present this in what fashion? Because when you have three things that do the same thing, how do you discern between them, and how does your patient at that lay level discern between them, and how do you save your time, and how, you know what I mean? It's just like you don't want to be talking in circles. So it's very straightforward, bullet pointed, touches on the patient's pain points and how to get them to understand more efficiently, more effectively, and to convert on what you're trying to accomplish based on the patient's needs.
Yep.
Do you charge for a package for ToeFX or lasers, or you charge per visit?
Yeah, we used to charge for packages, and it's not that it wasn't successful. We went to a pay-as-you-go model when the economy started kind of taking a little bit of a hit, because we wanted to test the waters and see if we were able to increase conversions by it's $150 investment. You pay as you go, pay as you go until you're satisfied. I recommend X number of of treatments or whatnot, but um, so we've seen a substantial increase in our conversions. It's difficult. I'm just going to throw it out there for everybody because I'm looking at these numbers just today. It is discouraging when you make that kind of shift and you see your overall cash start to shrink in 1 month, but you have to apply it to all the months of once it starts to come in after the fact, because it'll build over time. So to answer your question, we're pay as you go right now. I think you have to play around with it too. I don't think that's a one shoe fits all type of
I'd love
situation.
to do a webinar in toe tactics about packages versus a la carte
Yeah.
That's
because
amazing.
we've done both. And honestly, national, local economic um, climate dictates a lot of our pricing. So
Yes.
we're
We
not just looking at, you know what I mean? We fluctuate our pricing based on economy. Just because, someone says, I don't want to discount my services. I'm not discounting my services, but if my conversion goes up 70%, yes, I am, but I'm still profiting more because I'm meeting people where they're at. For
mhm.
example, like I do not go out to dinner anymore. Do I have the means to? Absolutely. But I am offended by the food prices. But if someone said, "Hey, you know what I mean? Let's work with you a little bit." I think I would be more inclined to visit that establishment more frequently and recommend that establishment. So I think there's different ways to go about doing it. Like I don't want to do anything on the cheap. I mean, I'll take out trash. I don't really care. But I think you also have to be very aware of what's going on, in the US, globally, what's happening. So we are very much, an economy driven practice.
Yeah, I understand. The reason I ask also about packages, to me, the advantages of asking for the sessions upfront, that I think that the compliance is better because then if people didn't pay, so they do pay as you go, so they maybe, postpone the treatment or maybe cancel. Um, so yeah.
I think that comes with a lot of education and in that transparency. This is the recommended treatment protocol. If you select and you opt to only have 2 of 6 treatments, then you're going to understand that you're going to get the benefit of 2 of 6 treatments. That's not what's recommended by the studies and the guidelines, but if that's what you feel like that you can do right now, then I'm fine with that. But I want you to know that the recommended treatment, and the studies have shown it's 6 treatments, but we'll do whatever you like. I tell them all the time, I'm like, you're the boss. I work for you.
Cool.
What do you want to do?
Hmm.
It's better because to them they're like, well, maybe it's something, maybe maybe a little bit, but as long as they understand that we're off label at this point. So if they're fine with that, then I'm fine with that. Like
Hmm.
it's just an honest conversation that takes an ounce more effort. That's it.
Right. Okay.
Good
I answered
deal.
a couple of messages in there. Hope Dr. Steins asked treatment or cost per treatment session through 2FX. We do 150. I've seen, and I'm sure you can speak to better than this than I can. I've seen others do 120. It varies between what you're confident in doing and your area too.
I'd
Um,
say 150 across the board is very safe.
I
Yeah.
like 150. Something we've implemented is a more of a cost per time model. Like Remy, if it's going to take me 30 minutes to do a Remy, then that's going to be an equitable amount of money to what it takes to do a TOEFX. Um, since it's paid off and I don't really have to worry about that, then it's how much time does it take me to do it? And that's the easiest way to think about it. And then somebody asked for Dr. Earl's email, which I sent to them, Dr. Earl's. So if
Sounds
ETH
good.
messages
Well, I
you,
hope this
you know
was
why.
beneficial. Um, Dr. Vanham, is there anything else you wanted us to discuss or anything else you think that we should highlight? I mean, outside that we are, 100% resources to anybody that wants more information about this. Happy to help implement this in the practice. Just sharing our experience, and so far so good. I'd tell you if there were any complaints. Um, if we do get some bad cases or something that's not working, then I'd love to, definitely record why it didn't
Hmm.
work. So that patient candidate selection is we can mitigate that next candidate that's not a good one, or at least further educate them or something.
Yeah, diagnostics is a very important part of the process to make sure that you're dealing. Yeah, I know the clinician normally knows, but there is errors, so it's so hard to know. So it's super important to do proper diagnostics.
Absolutely.
And
So
that's
my
with
first target demographic would
anything.
be dermatology and then family practice because I I don't know, I may reverse those because family practice they don't want to treat fungus.
No, and also
So
derms.
that's value add to them. So if it were me, Cody, we might want to consider taking the actual machine to do a on-site demo,
Hmm.
ideally with a doctor that has fungus, um, to each of the family practice, internal medicine, whatever, locations so they can see it. And then we could even do kind of like a round robin. Like we could sign up that one doctor or one provider for one treatment a month for 6 months. I think that would be a good worth marketing money expenditure to take that there to walk them through the process because it's going to be, and then we could take something with us for the rest of the team. You know what I
Hmm.
mean? Because it's like it's easy to travel. It's an easy demo. We could even take it to health fairs.
Hmm.
They just don't know
Once
about it.
I can look for, once we were asked in Canada to develop something for family doctors, so the podiatrist can send it to them. So you can maybe, um, I don't know, they use fax, no? They use sometimes fax, so you can,
Oh yeah,
Yeah.
yeah,
that's
right. So
all we
you can
use.
fax
I don't
them
know if I
the
want to develop anything for family practice doctors because then that will eliminate us.
no, that they will refer patients to you. No,
Ah, okay. Yeah, I was like,
Yeah.
yes,
why did you do something for them?
no.
Great.
This was your intention, no, to go for a demo.
Yeah.
Yeah,
Oh, like a marketing piece. Maybe you and I can like work on some pain points of patients and whatnot. I would love to. And like you get the science and I can
sure.
communicate. Yeah,
Yeah.
absolutely. That
Oh,
that material would be so valuable to the patient and the provider because the family they don't want to treat it. They're just like, get out of here because
no,
it's
they don't even want to sample.
nope.
Mm-mm.
And also dermatologists, they don't want to treat fungus because they treat other things, wrinkles.
It's a low ROI for them.
Very low.
It's
Yes,
time
exactly.
intensive. It's just not their, plastics and, podiatrists, we're used to doing services. So
Right.
Mhm.
family
So
practice is not.
something
Yeah, I
we
would
talked
love
about
to do
was
something like that. And also, we have something that I think we will bring into market soon. It's a AI for diagnostics, but it's less accurate than, lab, but it will tell the patients if probably they have fungus, and then we will refer them to a clinic close to their home, and then they will come to a clinic for tests and then a treatment. Because I feel that many patients do not know that they have fungus, or right, so they just ignorance. They need some education.
I think a good visual of different types of fungus would be good in your brochure because a lot of patients think, I don't have that nail if they've got a
Right.
couple white dots
Mhm.
on it.
Oh,
You know what I mean? We know where that's headed. But so I would go from the most mild of cases to the most major. So you're going to connect with many people in between.
oh, okay. Good advice.
agreed.
Okay. So I'm looking
Cool.
forward already for the next time. We'll coordinate it soon. And have a good night.
Awesome. Thanks, everybody.
All
Just
right.
email me if you have any questions. Happy to help.
Thanks, guys.
Bye.
Bye.